Integrated curriculum. Objectives of the lecture: a move to an integrated curriculum, advantage of integration, focus for integration, the integration continuum. Move to an integrated curriculum. An integrated curriculum bringing together different disciplines offers major advantages. The most significant change that has taken place globally in medical education, the move from curricula that focus on individual subjects or disciplines to a program where the teaching and learning is integrated. In a traditional discipline-based curriculum, subjects were taught in separate courses, each with its own program of lectures and assessment. Students learn about the structure of the heart in the anatomy course, the cardiac drugs in the pharmacology course, and the abnormality of the heart in the pathology course. In this slide, a comparison between how subjects are covered in a discipline-based and integrated curriculum relating to the cardiovascular system, for example. In discipline-based, we have many subjects have to be covered during the 6 years of study, like medicine, surgery, pathology, microbiology, pharmacology, and so on. While in integrated curriculum, all these subjects are taught in integrated manner, integrated with each other. Advantages of integration. Integrated teaching reflects the practice of medicine. For example, in a final examination in medical school that had a discipline-based curriculum, a student, when asked to take a history from a woman with abdominal pain, inquire whether he should take a medical, surgical, or gynecological history. He had clearly failed to integrate what he had learned in the different clinical attachments. Integration motivates the students. Integration by relating theory to practice makes learning more effective. An integrated curriculum can help to avoid unnecessary reduplication. Also, the integrated curriculum may be more cost-effective in that case. An integrated approach promotes collaboration and communications. Focus for integration. An integrated curriculum may have one or more themes. For example, the body system, most commonly adopted approach in the early years of the medical course. Students study, for example, a 6-week course on the cardiovascular system, a 5-week course on the respiratory system, etc. For example, life cycle. A focus for the integration may be the life cycle, including the newborn, the child, adolescent, the adult, and the elderly, and the dying. This may be used in conjunction with a system-based approach. For example, the clinical presentation or descriptions of the task facing a doctor. Task-based learning is a usual approach to integration, particularly in the later years of course. Now, the integration continuum. Discussions about integration have been polarized, with some teachers arguing in favor and others against integrated teaching. In the SPICES model for educational strategies, integration is presented as a continuum with full integration at one end and discipline-based teaching at the other end, as Harden in 2000. A position between the two extremes may be adopted integration ladder. This has been found to be a useful tool to explore integration in a curriculum and to identify the most appropriate level to suit a particular curriculum. Step 1 in the ladder: isolation. Departments or subject specialists, represented by squares, organize their teaching in isolation with no consideration of other subjects or disciplines. Step 2. Awareness. The teaching is subject-based, as in Step 1, but some mechanisms are in place whereby a teacher in one subject is made aware of what is covered in other subjects in the curriculum. Step 3. Harmonization. In harmonization, teachers responsible for different courses consult with each other and communicate about their course. For nesting. In this integrated approach, the teacher includes within a subject-based course knowledge and skill relating to other subjects. Step 5. Temporal coordination. The timetable is adjusted to that related topics within subjects are scheduled at the same time, with similar topics being taught on the same day or week. Sharing. Some teaching is shared between two departments or disciplines, implanting the teaching program. 7. Correlation. In addition to the subject-based teaching, an integrated teaching session introduced that brings together areas of common interest in each of the subjects. Step 8. Complementary. There's both subject-based and integrated teaching, but with integrated sessions representing major features of curriculum. Step 9. Multidisciplinary. A number of subjects are brought together in a single course with an integrated theme, but with the subjects clearly identified. Step 10. Interdisciplinary. A number of subjects are brought together in a single course with an integrated theme, but with the subjects clearly identified. 11. Trans-disciplinary. The integration is built around the field of knowledge as exemplified in the real world rather than a theme or topic selected for the purpose. Thank you for your listening.